Good morning everyone. I hope you have understood about previous topic in the last video. Now in this video I am here to discuss with you about some communicable diseases. So kindly listen it very carefully. So students, let's get started. So we will be discussing about our first disease, that is tuberculosis. Tuberculosis, it means TB, is a potentially serious infectious disease that mainly affects your lungs. The bacteria that cause tuberculosis are spread from one person to another through tiny droplets released into the air via cough and sneezes. Tuberculosis or TB, as it's commonly called, is a contagious infection that usually attacks your lungs. It can spread to other parts of your body like your brain and spine. A type of bacteria called Mycobacterium tuberculosis causes it. Tuberculosis (TB) is caused by a type of bacterium called Mycobacterium tuberculosis. It's spread when a person with active TB disease in their lungs cough or sneezes, and someone else inhales and expels droplets which contain TB bacteria. It was firstly discovered by a German physician and biophysiologist Robert Koch in 1882. It is caused by the lack of ventilated rooms and deficiency of vitamins in food of the body. Due to the lack of rest and sleep and consumption of infected eatables and drinks. Incubation period. So do you know that what is incubation period? It is the period of time in between from the entry of microorganism and occurrence of symptoms of diseases. Incubation period. Generally, incubation period of tuberculosis can be a week or a month, or it can take a year too. Mode of transmission. Well, I think that you all already know about the mode of transmission as we have discussed. The germs of tuberculosis are spread out during a sneezes or cough of an infected person. The water droplets containing germs of disease are spread in the atmosphere well. When any healthy person comes in contact with it and inhales those droplets mixed with the air in the atmosphere, he also gets infected with the disease. Now, I am going to tell you about some common occurring symptoms for tuberculosis. Common symptoms: cough that lasts for more than 2 weeks with a green, yellow or bloody sputum, weight loss, neck fatigue, loss of appetite, fever, chills, night sweat, chest pain, shortness of breath. Additional symptoms can also show if the disease has spread beyond the chest and lungs. For example, if lymph nodes are infected, there will be swelling of glands at the sides of the neck or underarms. Now, let's know how it is caused. Causes of tuberculosis. Traveling, living in places where TB is prevalent. Healthcare workers who are exposed to patients with active TB. People suffering from diabetes, kidney disease, malnutrition. People who have been using steroids for a long time, pregnant women and people undergoing radiotherapy are at a higher risk than others. Now let's us know the prevention. Preventing TB. Patients should cover their nose and mouth while coughing or sneezing. People who are at risk or in contact with a TB patient should be tested regularly. Face masks should be used by healthcare professionals when dealing with patients suffering from TB. It is important to take medications as per the doctor's instructions. It is crucial to understand that if the medications are stopped in between the prescribed courses, TB infection can recur. Now, let's move towards the next disease, that is cholera. Cholera is an infection of the small intestine by some strains of the bacterium Vibrio cholerae. Symptoms may range from none to mild to severe. The classic symptoms is large amounts of watery diarrhea that lasts a few days. Vomiting and muscles cramps may also occur. Diarrhea can be so severe that it leads within hours to severe dehydration and electrolyte imbalance. This may result in sunken eyes, cold skin, decreased skin elasticity, and wrinkling of the hands and feet. Dehydration can cause the skin to turn bluish. Symptoms start 2 hours to 5 days after exposure. Next is ways of transmission. Cholera is caused by a number of types of Vibrio cholerae, with some types producing more severe diseases than others. It is spread mostly by unsafe water and unsafe food that has been contaminated with human feces containing the bacteria. Undercooked seafood is a common source. Humans are the only animal affected. Risk factors for the diseases include poor sanitation, not enough clean drinking water, and poverty. Let's discuss for prevention method. Prevention method against cholera include improved sanitation and access to clean water. Cholera vaccines that are given by mouth provide reasonable protection for about 6 months. Next disease which we are going to discuss is rabies. Rabies is a viral disease that causes inflammation of the brain in humans and other mammals. Early symptoms can include fever and tingling at the site of exposure. These symptoms are followed by one or more of the following symptoms: violent movements, uncontrolled excitement, fear of water, and inability to move parts of the body, confusion and loss of consciousness. Once symptoms appear, the result is nearly always death. The time period between contracting the disease and the start of symptoms is usually 1 of 3 months, but can vary from less than 1 week to more than 1 year. The time depends on the distance the virus must travel along peripheral nerves to reach the central nervous system. Now let's know about who are pathogens of rabies. Rabies is caused by Lyssa virus, including the rabies virus and Australian bat Lyssa virus. It is spread when an infected animal bites or scratches a human or other animal. Saliva from an infected animal can also transmit rabies. If the saliva comes into contact with the eyes, mouth, or nose. So students, next topic which we are going to tell is prevention and treatment of rabies. Animal control and vaccination program have decreased the risk of rabies from dogs in a number of regions of the world. Immunizing people before they are exposed is recommended for those at high risk, including those who work with bats or who spend prolonged periods in areas of the world where rabies is common. In people who have been exposed to rabies, the rabies vaccine and sometimes rabies immunoglobulin are effective in preventing the disease if the person receives the treatment before the start of rabies symptoms. Washing bites and scrub for 15 minutes with soap and water. Povidone in iodine or detergent may reduce the number of viral particles and may be somewhat effective in preventing transmission. So students, you are understood rabies. Next disease about we are going to talk about is malaria. Malaria is a mosquito-borne infectious disease that affects humans. And other animals. Malaria causes symptoms that typically include fever, tiredness, vomiting, and headaches. In severe cases, it can cause yellow skin, seizures, coma, or death. Symptoms usually begin 10 to 15 days after being bitten by an infected mosquito. Now, let us know about the pathogen and carriers of malaria. Malaria is caused by single called microorganism of the Plasmodium group. The disease is most commonly spread by an infected female Anopheles mosquito. The mosquito bite introduces the parasites from the mosquito's saliva into person's blood. The parasites travel to the liver where they mature and reproduce. Now, let's discuss for some prevention against malaria. The risk of disease can be reduced by preventing mosquito bites through the use of mosquito nets and insect repellents, or with mosquito control measures such as spraying insecticides and draining standing water. Several medications are available to prevent malaria in travels to areas where the disease is common. So students, your various communicable disease is completed. In the next video, we will discuss about your next topic, that is body defense. Thank you everyone.